So I am Kiran Bains. I'm a practitioner health psychologist and one of the EDI co-leads. And I work in a hospital part time, and I also lead a community organisation part time. And I'm also affiliated with a university and for the time being. And over to you, Nikki. Yeah.
Okay, so I'm Nicki O'Brien, and I am an affiliated university where I spend
Yeah.
the majority of my time in a psychology department, and I am the other co-lead for EDI. Yeah, that's me.
Great. Okay. So yeah, let's go for the questions.
Yeah. Shall I
Yeah.
ask you first then, Kira? Yeah.
Yeah, no worries. Yeah.
So what brought you to the role in the DHP in the committee?
I was on the EDI task force for 2 years prior to taking a co-lead role, and um I was actually encouraged to go for it by the previous co-leads because they felt I could bring a lot to it, and I thought, well, I hope so. That's my aim, and I thought that this could potentially have a, quite a significant impact if we thought about how we do things, particularly around policy and process, which could have a lasting impact. And I was quite interested in doing that and then being able to scaffold something for others to build on in the future. So I'm hoping that my hope was to create a bit of a lasting impact for our profession and the people that we serve as well. Um, and how about you?
Yeah, so I wasn't involved in the task force before, as you were, um, but came about to the role through wanting to get back involved with serving the DHP in some way, being part of the committee, having previously been part of it many years earlier. Um, More recently, through some of my own research and just through wider kind of psychological practices, I've become really interested and more of an advocate for EDI good practice across kind of different settings. That's mainly in an academic sense through
Mm.
research and teaching and ensuring that that's done as well as it can be. As part of that, I have a role in my department for the director of EDI in the psychology department where I am. So yeah, it was wanting to bring that experience, but also develop that experience through health psychology in general, through practitioners as well as just as linking into the academic settings.
Yeah. Yeah, and I think that probably touches a bit on, our past experience, what you're talking about there, um, and that was, and what I was going to talk about next, I guess. We preempted ourselves. Um, in terms of my past experience, I have been involved in um, looking at health inequalities, since my doctorate actually, and really working with underserved groups since before that, pretty much, over my qualification journey. It's always been something that I'm really passionate about, and when it came to EDI, and more formal involvement, I guess what I have been doing has been training people to on working with certain underserved populations at work. I've been kind of like you, I've been an advocate, and used some of my knowledge that I've gathered to help, my previous service become more equitable, and to be more informed around, working with people of the global majority, or, as we like the other term we use is the UK BAME population. Um, and also I was involved quite heavily in anti-racism efforts within another network of psychologists, and leading some anti-racism training, something that I've been engaged with for a long time, that I've built years of experience in, I guess. But also in my current role, we do have an anti-racist service, so we talk about that on at least a monthly basis, and we all kind of take our different roles within that quite seriously. I also should mention I've been doing work around LGBT plus inclusion as well, and I may be doing that a little bit where I work. So yeah, just it kind of weaves into a lot of the kind of things that I do professionally, as well as
Yes.
not just something that's on the side, I should say, as it seems like it does for you. It's woven into your kind of your role and the things that you've looked at, and yeah,
Yeah.
yeah.
Yeah, no, I agree. I think, yeah, it's when it becomes kind of something that you're interested in at a level, and then that interest becomes passion, and that passion then becomes almost a necessity. You can't see why it isn't being done in every, or isn't being recognized or
Mm.
considered in every area then. Yeah, no, I would agree. I think through some of my experiences, obviously from in an academic sense, in the institution where I work, it's been thinking from student level to how can from the outset, from the undergraduate students right through to postgraduate students in psychology, how can we get them thinking about EDI issues and concerns and considerations from them interpreting data or designing their own studies, and thinking about the implications of it. So I've done trying to do some work with the other academics in the department to raise awareness of them considering the portfolio of research that they are presenting when they're teaching a particular topic, and trying to make that curriculum more representative, or at least acknowledging where there's a lack of representation rather than just making it the case. So yes, work with students, particularly on the MSc Health Psychology, getting them to really including that in some of their assignments, so that they're explicitly asked to consider different EDI factors in their assignments as part of it.
Sounds really exciting.
Yeah, it's nice. It's nice to be able to do it, to try to make it the norm, the normal practice that you should be doing. And I guess that's the other end. You're in that practitioner role where you are trying to embed it with people then. And what hopefully I'm trying to do for those who do go on to be practitioners, it will be much easier because it will be something that they've already acknowledged the value of.
Absolutely. And I think one of the reasons why I'm hopeful and excited about that is, as a practitioner, I work with people of the global majority. Primarily, I work with people with sickle cell, and rarely ever is there any research with people with sickle cell. And as a practitioner, I find that frustrating, because we know that there can be quite a nuance in how people experience illness over the lifetime, and that can vary from the population to population of people that we work with. So and that makes it a little bit difficult, really, sometimes to craft things you know based on that knowledge, because the literature isn't there. And and a lot of what we do is we do things in practice, but sadly the research practice links, as we know, there can be quite a bit of a gap between them. So yes, I would, I think it feeds into, it does have an impact on what we do, and also to what extent can I draw upon health psychology models and literature if it doesn't really, it's not necessarily easily applied to the work that I do with the client. So I feel that it also means that it has a knock-on effect, on practitioners like myself, who then, who are working in a field and, you know, sometimes struggling. Although I'm thankfully, my identity as a health psychologist is well recognized within my team. It's hard for us to sometimes really show how of how we can be valuable in that setting if the research isn't there to kind of support what we do. So yeah, I really appreciate that that is being done, because it just can have a downstream impact, as well on the work that we do with our clients.
Yeah, definitely. It certainly can, can't it? And I
Yeah,
think those, like you say, those are those experiences that we've had that or that we have and we continue to have and continue to see, which just make you even more determined to see a change or to try and work towards a change, even if you don't quite get to the seeing the change, if you can quantify it in that way.
yeah.
Um,
Absolutely. And I would just say, I mean, I will kind of will move on to the next thing in a moment. I think the other thing is, and I think it's maybe become a bit more increasingly obvious in the last couple of years, perhaps, that when, these kind of, when we don't think about any beyond a subset of our population in terms of who we have in the field and who we do research on and who we work with, then that also leaves us vulnerable, because, in the sense of that, apart from practitioners like myself in a acute health setting, we can see that also with the outbreak of COVID. And soon afterwards we had the protests of Black Lives Matters protests happening everywhere, and there was no way of knowing what, if anything, that impact that had in terms of risk of transmission at the time. No way of knowing that because we didn't have those connections and those links, as it happens, at the time, with because there's outdoor ventilation, and it was, ended up being relatively low risk compared
yeah,
to other things, but we could have been really caught short there. And also the other thing is that it makes it really tricky if we only consider our population, on a wider scale. Then we know that a lot of people in the world don't have access to vaccination. So again, that really, leaves us all vulnerable. And I think that's, in some ways, although practically it's frightening, it's also symbolic of some of the long-standing issues that we've had around health and health equity. And
yeah,
yeah, really highlights a lot of the problems that we have, I would say.
yeah,
Yeah,
definitely. You're right. I
yeah,
mean, looking at it from inclusion into inclusion of certain groups or exclusion of certain groups, into research or into trials, therefore leading into the evidence base that we have for certain things, and then trying to implement those approaches when you have in those groups that you may well have originally excluded or not included in the research, in the evidence which you're using to inform the use of them.
yeah,
It is kind of, it can be at all levels, can't it? It can be at all levels then that it's, um, like you say, leaving particular groups vulnerable. It
mm,
multiple kind of, because they haven't even got there's not the evidence of the use of a particular thing for them in the first place, and then they haven't got the access to it,
yeah,
or the knowledge, or the desire, even, let's say, the desire to even want to access that thing which some they're being told is potentially useful for them, but there's this disjoint, isn't there? The total
and there
disjoint in
really
it.
is.
Yeah,
Yeah.
no, I agree.
Yeah, I think sometimes we kind of think it, and part of the reason why I brought the point of, leaving us all vulnerable is that sometimes we struggle to recognize that it harms us as well as the people that we serve, because that can be more subtle,
Yeah,
yeah, so I think, yeah, no, absolutely. And there's that destroyed mistrust, and this is why I'm hoping that we can be a bit more proactive, moving forward. So I'm going to ask you,
Okay.
that's okay. Um, what do you hope that we can achieve from doing this, doing this role?
Yeah, so I guess to be able to see that you say some sort of, I think the expression used of some sort of lasting change or lasting impact. I can't remember you said at the beginning. I think
Yeah,
that's it. Something that's meaningful. Hope to achieve something meaningful. Exactly what that would be, I don't know that can easily be defined at this stage, because it's going to be kind of dependent on the whatever is happening, whatever we need to present in a responsive way, what we may need to respond to in the moment, and then the kind of underlying processes that hopefully we can start to build up, but we're not going to be able to necessarily address everything that we'd like to. But yeah, perhaps kind of just making the issues more well known, if you like, or greater
yeah,
awareness of those issues, and starting to try and tap into how we can tackle them with small changes, which cumulatively hopefully will produce something larger. So that's probably not really concretely answering your question, but it's because I think there's so much that can be done. I'd
yes,
love to say we could, fix everything, but it's not, the reality isn't going to be the case. So for me, genuinely, I think it's more going to be about raising awareness of the small things people can do at an individual level, and the small things that we can start to build the stepping stones of to create the bigger impacts.
absolutely.
What do
And
you
I,
think?
I agree that yeah, my hope is that if we can change the way that we do things, through the policy and process, we can embed EDI, and it no longer becomes an extra. It becomes something that's part of the wider work that that's done. And I think I'm encouraged by what I'm seeing there in terms of the will to do that, which is exciting. Or the other thing I would say is that would say it's maybe not a a good idea for us to think that we can fix everything ourselves. Kind of think we have to be careful there, that we, in thinking whether we have all the solutions ourselves, when actually also some of it I feel would be helpful is to tap into what people are doing and encourage mutual learning. My thinking is very, it's collectivist in some ways. So I think that one of the things that I've been learning about how people have strove for equity in the past, and I read a lot of books. For example, bell hooks had a lot of things to say about equality and about progress, and one of the things that she argued was that if we focus on narrow set of priorities from a narrow set of people, then and they achieve those priorities, then they can end up being disengaged from movements towards positive change, and then things can become fragmented, and like as a whole, you can lose you can lose the progress that you've been striving for, which we can probably see actually happening at the moment, because you are fragmented rather than working with a wider cohort of people who would tackle different things in a coordinated way, and you can actually more easily sustain progress and teach and learn. I certainly wouldn't say that I don't know about you, I don't know everything, but so that learning from each other and working together, I think, is a really important thing that I hope that we can achieve with
Yeah,
people in our profession and beyond. you
yeah,
know Actually, patient advocacy groups as well,
yeah.
they've had long history of aiming for better for themselves. So yeah, that's another thing that I hope we can start to build up towards.
I think that's a really important point, because yeah, and there's no point it being in a little silo of a couple of people or a handful of people trying to solve all these things. you know, like you say, it's not going to work and anywhere towards kind of creating a longer standing change in practice is only going to be if it involves all the right people, the different stakeholders, the different people who are going to be potentially affected by it, or directly or indirectly at all stages. So yeah, I agree.
Yeah.
Really want to learn. And I think the other thing is there's probably lots of people in the community, in the health psychology community, who are also as keen and as much of an advocate as you or I, and
e-
want to do something. And they're the people we want to know about and we want to meet and learn from and speak to,
Exactly.
isn't it?
Yeah. Yeah.
Yeah.
Yeah. Um, so yeah, would you like to that choose the next question?
Yes. So what would you, well, what should we say? We've kind of covered some of them. What do you think then in terms of fitting in with the wider committee? Let's have a committee. So how do you think our role would fit within that wider committee?
I hope, and I think it would be a case of looking at different roles that people in the committee have around, say, research, around training, and around practice, and connecting with them in order to change potentially how, or not necessarily unilaterally, I would say, but to like work out ways together that EDI processes and policies can be embedded in what they do.
Yeah,
I think that would be really, really helpful, and yeah, and that might they may well also have an idea of what some of the barriers are as well, or what the kind of things can help facilitate, changes, or implementation of those kind of changes in practice as well. So that's my hope.
yeah.
Yeah. How about yourself?
Yeah, no, I'd echo what you say, and I kind of, yeah, I'd also add that I suppose that it's the roles, the other roles that people have in within the committee, they will have their place as part of other further networks, won't they? You know, beyond the
Yes.
committee, in the same way as we'll have links with networks more
Yeah.
specific to EDI, arguably, but they will have their links beyond. And I think that's what we
Yes.
really want to kind of maximise, is that
Hmm.
transference, but you know, bi-directionally, of the learning, of the sharing, that we
Yeah.
can learn and share with them and they can learn and share with others and then pass back. And um yeah, because I think that that's probably where the committee has its strengths, doesn't it? Because it does
Yeah.
have lots of webs, lots of parts to it that feed into other areas.
Absolutely. I think what we can also learn from is, how they've did things like set up the health psychology exchange,
Yeah,
that was just, punched way above its weight in terms of impact, so when we do, work together like that, we can just achieve
yeah,
incredible things. Yeah, I agree with you on that.
yeah.
Yeah.
I was going to say, have we got any other? We've kind of talked about some how we see it sitting in with other roles. We've kind of covered a couple of the other things, haven't we? Unless there's anything you think, Kieran, in terms of other kind of barriers or facilitators that you can imagine faced at the moment or in the future?
I think sometimes people, I would say psychologically, one barrier I'm aware of is that sometimes people find it hard to think about how to do this and how to avoid making mistakes. And I've certainly experienced this when facilitating, say anti-racism sessions, that there can be a lot of discomfort at times from everyone involved. And my hope is that if we can, if you like, use a more compassionate approach and show people how, like, we model that so they can then spread that out amongst their networks, for example, then that would go a long way in addressing that, because I think consciousness raising can be an important part of what we aim for. And I would also say that some of what I've experienced sometimes is that when you have mixed groups of people, and especially when it comes to talking about issues that will affect a marginalized group, or racialized minorities mixed with white participants, you find that it takes it you often find that people who go majority are very quiet in that setting, and it takes a time to build trust. So it's not something that happens, straight away for everyone. And you do need to put certain things in place for that kind of thing to work. And I think we do also need to acknowledge that sometimes there are going to be people that who maybe aren't on board with our vision, and are quite happy with the way things are. And that sometimes, it's say, for example, how universities work, it's sometimes like the easy wins, in terms of who you do work with, and publishing journals, articles. I'm sure you can speak to this. That sometimes if you work with underserved populations, it can be difficult to be in a high impact journal because they kind of frame it as a niche population, which is a wider issue that we face. But it's important to acknowledge that and work bit by bit. Is
Yeah.
there anything that you have experienced barriers wise that you feel that can be a bit tricky for us?
Yeah, I think, yeah, I agree with publishing. There's certainly that. I mean, there is obviously encouragingly more of an effort and kind of a focus to look at the weird populations, as they've called them, that kind of the different groups, and there is certainly more of a yeah, quite rightly, a need for that, as there is, but that's not obviously always the case with some, in the way that some journals are within their remit. But yeah, no, I think health literacy is a big thing that's kind of really needs to be considered for
Yeah,
all research, for all implementation, for all kind of practitioner roles as well. And I don't know that that's always recognized as well as it should be from the how accessible information is,
yeah,
health information is for people, whether that be from the letter that's posted out to the patient to come and find the right address for where they need to get to for their appointment, so that that person doesn't get there late or doesn't miss their appointment and then need
yeah,
rescheduling. There's huge, obvious kind of economic benefits of ensuring things work here. But I think more
yeah,
importantly, it's the personal, it's the social benefits, the fact that we should be addressing things, considering how we address it and considering how we frame things,
yeah,
and perhaps not always using word, not always using text, not always using language, and
yeah,
finding alternative methods is something I'm particularly passionate about, to to be able to get that message across as effectively, if not potentially more effectively, without creating exclusive groups who can only absorb that information, let
yes,
alone even try to understand it. So I think, yeah, there's for me, I think that's something that needs recognizing at all levels of organizations or teaching or research practices.
absolutely, yeah. I mean, and on a more positive note, I think there's, as we touched upon earlier, I think there's, I think most people in our profession, I would say that I've come across, there's definitely a will to try and address these issues, and I'm like quite encouraged by that. And I don't know about you, but I think, also touching upon how well we can work together when we come pull together as a collective. I think that's definitely something to reflect on, and make the most of that power that we have. Um,
Yes.
yeah,
Yeah, and to shout about it, those things, to shout about those things that we're able to, we have pulled together on and done successfully, to kind of, encourage others to do the same, isn't it? Encourage others to also follow that desire, that goal that they want to work, to come together and to produce something beneficial for others. So I agree.
yeah. Okay. I don't really have anything else to add at the moment. I'm not sure if you got anything else.
No, I don't. I was looking at our list there. No. Final thoughts or questions? No, I've enjoyed our conversation very much.
Me too. And yeah, I'm looking forward for us to us working together and yeah,
Definitely. Definitely.
getting on this journey and
Yeah.
yeah, yeah.
Brilliant.
Okay, thanks very much. That's it from me, and yeah, and
Yep, that's it from
I
me too.
hope our listeners have enjoyed learning about us and what we hope to bring, and hope to get their engagement too.
Yeah, definitely. And for everyone to get in touch if they want to have a chat more.
Yeah, absolutely.